All right, good morning. Since I happen to have Gabby in my at my lap, we're going to hit her with her dental spray, and then we're going to send her down on the floor. Good girl. Oops. Continuing my daily dental health challenge for the month. There you go, little girl. All right, so welcome back, everyone. I got to give Instagram a minute to catch up because I didn't set it up. We good, Gwen? Yeah. We're good. Okay. All right, so I'm at the office today. Got tons of work to do, so I came in. So yesterday we talked about getting our pets through the anesthetic procedure, trying to help overcome some of your fears of having your animals put under anesthesia. And I know that it is pretty nerve-wracking. Do we need to make any toothpaste or just use a spray? You can do either. Brushing is the gold standard. We'll talk more about that tomorrow. But if your pet won't let you get in there with a toothbrush, their face is too scrunched in to get in there with a toothbrush, you don't have a small enough toothbrush for cats and small dogs, then using the spray can be an easy way to kind of get around that. You can also put spray or coconut oil on your finger or a finger brush and use that. So there's lots of different ways we can do that. So today I wanted to talk about caring for your pets after the dental cleaning or dental surgery and what we can do to keep them comfortable, whether we have to give antibiotics, they've got stitches in their mouth, what is going on that we need to be aware of, what we're going to do for pain therapy, and also ways that we can detox them, because these are animals that are going to have had a fairly long anesthetic procedure, which means there's all kinds of medications and drugs in their system that we want to help them detox. So that's why it was so important before the dental procedure to have that lab work done, so that you know we've got a liver that's functioning well or not, we've got kidneys that are functioning well or not, the animal has good circulation that is going to help move the chemicals through the body, through that filtration process to get them out. So when you go to pick up your pet from the procedure, either a technician or a doctor should go over with you everything that was done. Remember the charts I showed yesterday of Gwen's cat's dental procedure, their discharge instructions, about 3 pages long, explained everything that was done. So you should get a good explanation of what was done during the procedure, which extractions were done, whether there are sutures in the mouth, and you should get instructions for post-op care, which may include antibiotics depending on how much infection was in the mouth. And that is a really interesting question that has been raised in the last few years. And I'll ask our specialist that we're going to have on Friday, but in the last few years, a lot of veterinary dentists are saying that we do not automatically have to give antibiotics during or after a dental cleaning, even if there are simple extractions. Now, certainly if we have really infected teeth, we've got deep extractions, that sort of thing, that's a different story. So you may or may not automatically need those antibiotics, and that's going to be a decision made between you and your veterinarian based on the amount of work that was done in the mouth, the amount of infection that was there. It also may depend on whether your dog or cat has comorbidities like mitral valve disease, where we don't want bacteria running through the system and latching onto those valves or getting stuck in the filtering process in the kidneys. So for the first 24 hours at home, now it's amazing to me if a good anesthetic protocol is followed. A lot of times these animals wake up from anesthesia and within an hour they seem back to normal. Some of them seem better than what was considered to be their normal because we've gotten rid of all that pain that they had in their mouth. Most of these animals, when they get home, they will be ready to eat a meal. It is recommended that you don't feed them right away. Remember, they've got all this anesthetic that they've got to work out of their system. And while they may seem wide awake and normal, that can make them nauseous. And the last thing we want is for them to vomit after having an anesthetic procedure and then end up with aspiration or some other issue. So it's really best not to feed them that first night home. And for the first 24 hours-ish, it would be much better to have them on liquids. And they can be healthy liquids, things like bone broth, goat milk. You could make a congee, which is a very thin soup. But something like that for that first 24 hours that's going to be very soothing to their stomach. A ginger tea is wonderful for that as well if they do seem to be nauseous. And we don't want to cause vomiting, and we also don't want to induce pain by them biting down on something if they have extractions, sore gums, that sort of thing. So our dogs and cats are quite capable of fasting for 24 hours, but giving them liquids like goat milk, bone broth, that's going to give them some calories, it's going to give them some nutrition. Those are things that are going to be very soothing to the gut and help decrease the nausea. And like I said, you could add some ginger tea to that. If there are sutures in the mouth, there should be no hard bones or chews for 7 to 10 days, because we want to allow all of that healing to take place where gingival flaps may have been sewn. So no hard treats, no hard cookies. For those of you who feed kibble, no hard kibble for that 7 to 10 days. So this might be a good time to say, hey, I'm going to cook my dog or cat something, or I'm going to get a gently cooked pre-made food, something that is going to be easier for them and not break apart what you just paid all that money to have done in the mouth. Pain meds almost always will be prescribed. Usually pain meds are given at the time of the procedure, and you should check with your veterinarian and know for sure, the technician, whoever you're talking to, you should know for sure what pain meds were given, because you do not want to have things that interact. So non-steroidal anti-inflammatories, things like meloxicam, carprofen, which is Rimadyl, Deramax, they cannot be given with things like aspirin or steroids. If your animal is already on medications, make sure that you and your veterinarian have a clear line of communication about what the pet is already taking. Do not give anything over the counter at home for pain, because depending on what was given in the office, you could give something that would totally interact. So no aspirin, no Tylenol, no ibuprofen. We should never give those to our pets, particularly cats, but we should never give those to our pets. They can be very toxic. So none of those. You could give an herbal pain relief, something like the DGP, which is doggone pain, which is good for dogs and cats, even though it's named doggone pain. So you could use an herbal formula. You can also use homeopathic alternatives, something like arnica, which is good for pain. If your pet has been prescribed antibiotics or pain medications, whether it's non-steroidals or gabapentin seems to be very popular these days. Gabapentin can make them be very woozy and off balance. The non-steroidals can wreak havoc on the liver, the kidneys, and the gut. So if your animal is not eating, if they're nauseous, if they have diarrhea, stop all medications, get a hold of your veterinary office. I had one client once, we did a major procedure, and I can't even remember what it was. It may not even have been dental, it may have been surgery. The dog was sent home with carprofen, which is a non-steroidal anti-inflammatory. And I think we prescribed it for a week. And she called me and said that it's about 5 days out from surgery. She called me and said that the animal was not eating and that it had diarrhea with dark tarry stools. That dog had developed ulceration of the bowel from the non-steroidal anti-inflammatory. And unfortunately, the client waited 5 days to let us know that. We had called her the day after surgery. She reported everything was fine. And so here we were 5 days later, and the dog had a serious issue. The dog ended up doing fine because we were able to get things back under control. But always let your veterinarian know if they've got diarrhea, if they've got vomiting, if they're not eating within 24 hours after the procedure, you need to get a hold of them and get clarification on what to give and what not to give. So I did find from one of my homeopathic vet friends that for pain, bleeding, that sort of thing after a dental procedure, you can give arnica 1 m, so that's the dosing, and Hepasulf 200C twice a day for 7 days, or the Arnica 1M and Hypericum 1M twice a day for 2 to 5 days if there has been extensive work done in the mouth, a lot of extractions, that sort of thing. If there is bleeding in the saliva, there was bleeding during the procedure, you can give 1 dose of phosphorus 200C right after the procedure. So that might be something to even ask your veterinarian about giving at the hospital. However, if they are a traditional veterinarian, good luck on that one. So you might have to do it when they come home. So if your pet was given antibiotics during the procedure or sent home with antibiotics after the procedure, I would get them on some probiotics immediately. And we're looking for probiotics with multiple strains and billions of CFUs, which is colony forming units. So if you're using a probiotic that gives you a number on the back that's in the millions, not good enough. We need billions and we need multiple strains. So we're not looking for something that is just a lactobacillus. We're not looking for something that is just an acidophilus. We are looking for multiple strains. We have tons of different probiotics on our website that would be very appropriate, but I would definitely get these animals on a good probiotic, and you might even want to start that if they're not already on a probiotic. You might want to start that a week before the procedure so that we're building up their microbiome to be nice and healthy during and after. You want to watch your pet for signs of pain, dropping food, flinching if you get near their head, aggression if anybody gets near them or touches them or goes to pet them, increased drooling, blood in the saliva or the water bowl, bad breath, pawing at the face, swelling, drainage, or swelling around the eyes. Those could all be indications that we've got a secondary infection. So remember, even if your pet was put on antibiotics at the time of the procedure, there was no culture done. Generally, it's very rare to culture a mouth, and there could have been bacterial strains in there that are resistant to antibiotics that are being given, and you could end up with a big mess post-op, particularly if there were a ton of extractions and there are pockets in there. So definitely watch. Their breath should smell much better when they come home. But if it doesn't, or it gets worse in a couple of days, you definitely need to be in touch with your veterinary office. Once they're healed from their extractions, you can use softer chews, things like the softer dehydrated meat chews, or like the cocotherapy macaroons. They're a little bit softer, a little bit easier for them to chew, particularly during that healing phase. And if they had almost all their teeth extracted, there's not a whole lot left, then you may want to be sticking with those softer treats long term. A lot of these animals, like our Charlie, our 19-year-old Cavalier, he didn't have any teeth for at least 5 years, probably longer. He still enjoyed gnawing on a good raw meaty bone, and his gums were so tough that he actually could pull pieces of meat off the bone. He wasn't making a dent in the bone at all, but he still really enjoyed kind of playing with them and gumming them. So once everything is healed, you can still offer your pets something like that just for fun for them and entertaining, but they're certainly not going to chew the bone. Okay, so we also want to detox our pets from the anesthesia. We want to start some of these protocols before anesthesia, about a week before, and then go for 2 weeks after. Milk thistle, 100 milligrams per 20 pounds of body weight twice a day. So kitty cats could get 50 milligrams if it's a 10-pound kitty. Twice a day, start that a week before, go 2 weeks after surgery. NAC, which is N-acetylcysteine, 250 milligrams per 30 pounds of body weight. Again, twice a day for a week before and 2 weeks after. SAMe, which is S-adenosyl L-methionine. Small animals take 90 milligrams once a day on an empty stomach. Again, 1 week before, 2 weeks after. So the little animals 15 pounds and under are going to take 90 milligrams. Up to about 40 pounds, it's 200 to 225. And over 40 pounds, it's going to be 400 to 425 milligrams once a day. You could also start them on a B vitamin supplement, or add something like super greens or green juju, green veggie products, because they're going to be high in B vitamins. That helps them detox. You could use a B12 supplement, which is very good for digestive health. CoQ10, or quercetin, whichever you want to use, 5 milligrams per pound of body weight a week before and 2 weeks after, and that's twice a day. Foods with sulforaphane in them: broccoli, Brussels sprouts, kale, broccoli sprouts, 1/8 to 1/2 cup a day for 10 days, depending on the size of your pet. So most of that was for liver detox, and then for the kidneys, we can add parsley, which can be fresh or dried herb, or you can make a parsley tea and pour that in their food. Dandelion leaves or root, again, can be fresh, powder, or tea. The green juju just greens has a lot of this stuff in it. Golden paste, very good for moving stagnation, getting blood flowing, and helping things to filter. Vitamin C can be very helpful. Vitamin C is dosed to effect, and you need to use a buffered vitamin C. We have the RX Vitamins Bio C on the website. And then last but not least, spirulina, which is wonderful at helping with detox. So if you follow all of these procedures before the dental anesthetic dental cleaning, and after, so you've got about a 3-week period here. You're going to go in, you're going to get your pre-op labs, you're going to get your pre-op x-rays or imaging, whatever needs to be done to assure that your animal is safe to undergo the anesthetic procedure. Start your detox beforehand, go right on through for 2 weeks afterwards, and you should see amazing changes in your animals. Once you get rid of infected, painful teeth in their mouth, they will thank you. On another note, our animals start building plaque, which is that biofilm on the teeth, within 6 hours after the dental cleaning. So when they come home, you're not off the hook, folks. You have to do your daily cleaning. So they might be sore that first week after the dental. That's not the time to be brushing, but you certainly can be rubbing on dental drops or one of the toothpaste options that we're going to give you tomorrow. So taking care of that microbiome in the mouth and doing something preventative starting on day 1, so that we don't end up having to have 6 or 8 extractions every 6 months, because we see that in so many animals. Okay, everybody have a wonderful day.